Hello, and welcome to another session of the Captain's Table. My name is Dr. Jeff Pelton. I am a veterinarian in Santa Barbara, California, and today I am going to be discussing the very common question that we get all the time, which is, at what age should I spay or neuter my dog or cat? This is, as I said, this is a common question that most veterinarians deal with almost on a weekly basis around the country. And the reason for the talk is because these recommendations have changed over the last few years. I am going to spend the first part of the talk discussing why they've changed and the nature of some of this information and the studies themselves. And the second part of the talk, I will go over the specific recommendations and the health issues specifically for the animals as to why we are recommending certain ages for the altering procedure. So as I want to get going, there's a few things I want to start with first. One is most of the information, almost all the information we have out there is about dogs. Cats are, even though they're great and even though people are very, very emotional about their cats, it's actually more of a it's very, very straightforward with cats. The information out there is pretty linear. There's not a whole lot of argument anymore about it. And so as a result, a lot of the information that I'm going to be presenting today is about dogs. So to start with, when we look at the ages of spaying and neutering your pet, the way we look at it is there's the pediatric time frame, which is doing them when they're very, very young. There's the delayed now, which is trying to wait to a certain age, say over a year. And then there's the argument of abandonment altogether, which is do not spay or neuter your pet at all. As expected, I'm going to put in a plug that last one, people just do not follow that. Overall, most veterinarians, I think, are a strong proponent of desexing the animal. And basically the overall recommendation that if you're not going to use the animal for breeding, it should be castrated. One of the things to keep in mind is that when you are talking to your veterinarian about this is, yes, obviously we are very focused on the animal in front of us. We are very, very focused on what's going to be the best thing for your dog or your cat and your household and your situation. But as veterinarians, we also have to deal with population health. This comes into play whether we're talking about diet, vaccines, housing situation, training, all these different things. We still deal with the overall pet population in general. And so as a result, yes, overpopulation is still a major, major, major concern in this country. So with that, I just want to make a plug. Just remember, as far as general information, in the United States, consistently, approximately 7 to 8 million pets enter shelters every year. And a little under half of that, the totals usually range somewhere between 2.7 million to 3.5 million pets are euthanized. So of all the pets that get surrendered to shelters, approximately half of them are euthanized. Now, this can vary greatly by geography and where you are in the country, and it's city versus rural and all that. But just if you want to just kind of sit back and think about that and think 3 to 4 million pets every year are euthanized in this country. And to put it into a slightly different perspective, if there was an infectious disease outbreak in dogs or cats that was killing 3 to 4 million pets per year, don't you think that the owners would be demanding that somebody do something about this, try to figure out a cure? I mean, it's something that was killing that many animals every year. And yet that's exactly what this is. Pet overpopulation is resulting in the death of 3 to 4 million pets per year. So, now, specifically in the last few months, there has been some information that there's actually been a dramatic increase in shelter relinquishments between January and July of 2023. There's been a huge spike around this country in shelter animals being surrendered to shelters. And we knew this was coming. A lot of that was because during the pandemic, people were staying at home and they were adopting animals at record rates. I mean, I remember locally, some of our shelters didn't even have animals for adoption. And that ultimately ended up causing a few things. One, because of the pandemic, a lot of the spay neuter programs were suspended because we just weren't going out and doing those things anymore. And then the other thing that happened was there was a delay in castration and spaying of a lot of animals just because people weren't going to their veterinarians. And as a result, we had a lot of non-fixed animals that were not being properly socialized. People were home with their dogs, people were home with their cats all the time. These animals got very used to this over the course of a couple of years. When the pandemic ended and people started returning to a quote-unquote normal schedule, what started happening was they were going back to work and leaving these animals who grew up in a situation where someone was there all day, and they were leaving these animals at home. And then that has led to a lot of behavior issues and people who just can't keep these animals at home anymore by themselves. The other thing that happened was eviction rates went up. And during the pandemic, nobody could become evicted. And then as the pandemic ended, the eviction rates went up. People who had adopted animals, who had been able to have them for a year and a half, now all of a sudden had to find a living situation that maybe could not afford. They weren't allowed to keep their pets. And so these animals were then surrendered to the shelters. So even though that doesn't have a lot of impact on the talk, that's just one of those statistics that I wanted people to be aware of, so that you just understand that, when veterinarians, we are faced with this all the time. Here in Santa Barbara, our shelters are back to being overcrowded. So anyway, that takes care of the abandonment issue. Now, what that leaves for us is, now, assuming you're going to spay and neuter the animal, it's going to be, what about this information of pediatric, which is the super early spay and neuter programs, versus the delayed? And I want to kind of step back and say, okay, why has this changed? So when I was in school back in the 90s, the blanket recommendation was to spay and neuter your dog or cat by 6 months of age. This was a set in stone. Don't you dare vary off of this. And there's two reasons for that. One is, through the 60s, 70s, and 80s, there's a tremendous, even worse now, pet overpopulation in this country. And so the spay and neuter programs were essential in trying to bring that under control. And for the most part, it was relatively successful. Obviously, like I said, we're still euthanizing 4 million animals a year, but it used to be worse. So it wasn't until the time, we've now had the benefit of time to be able to look back and say, okay, we made these changes a long time ago, and what effect have they had now? So as a result of that, people, as we tend to look back and start to question, is this the best thing? A lot of that is because we started seeing some information that trickled out that said, hey, some of these, there might be some associations of problems that are dealing with dogs who have been, or cats who have been spayed and neutered early. And so, as people do, or as scientists do, they turn around and they say, okay, let's see if we can gather some information and try to figure out if there's actually a problem here. Now, one of the things that studies have to deal with, and this is where the reason for statistics has come in, it's the difference between having an association versus cause and effect. And when you say that action A leads to result B, just because when action A happens, result B occurs, does not necessarily mean there's a cause and effect. It can also mean there's just an association. And you see this throughout all literature, all scientific literature, and that's why statistics are necessary. And what they try to do is then try to boil that down to try to figure out, does A cause B, or does it just happen to be a coincidence? So if, for example, for example, when dealing with animals, these studies that have been done over the last couple decades, I will say right now, I'm going to plug right now, that it is still inconclusive. We still don't know for a fact, some of this information. And as more information comes out, sometimes our recommendations will change. This is why it can be so frustrating. And I can tell you that for every study that'll point to one thing, somebody might be able to find a study that doesn't necessarily point to something else, but it just basically says, no, that's not true. And one of the reasons that happens is when you deal with a study, the idea is to try to figure out as narrowly as you can, does action A lead to result B? And in order to pull that off, everything else in the world, everything else, all your different parameters regarding studies have to be the same. And so when you look at these studies about animals, one of the first things that pops up, obviously, is breed. Can a study that finds a certain or achieves a certain conclusion about a Rottweiler, will that hold true for a Shih Tzu or a Poodle? And that is just right there. That is one of the biggest problems that we have in some of these studies. The other thing is, so we have genetics, we have diet, we have lifestyle, breed, training, and socialization. If every animal in the world was trained the same way, if every animal in the world was given the same diet, it would be much easier for us to be able to then draw our conclusions, but we can't, and that's just the way the information works. So the other thing that happens is, in order to get this information, there's essentially two different ways studies are approached. One is prospective and one is retrospective. Most of the studies that you see, especially in veterinary medicine, are retrospective. And retrospective studies is usually a review of records, review of information about a very specific thing, gathering data and trying to then percolate down and sift through and try to establish some conclusions based on your theory. Prospective studies is when you start everything from the same moment, moving forward, trying to produce a specific result or study a specific result. Prospective studies, on the average, are going to be much more conclusive, because you are going to be able to be in control, or the people who are studying are going to be in control of all the different variabilities and all the different variables that can come from doing these studies. Whereas retrospective studies is just simply, we're going to go back and look at the records of all these dogs and see if we can establish a conclusion. So retrospective studies, one of the problems that we have from retrospective studies over the last few decades is that a lot of the information comes from referral centers. These are some of the academic institutions or specialty centers or something along those lines. Now, one thing to keep in mind is, say, hypothetically, you were going to be studying mammary gland cancers in golden retrievers. Okay. One thing to keep in mind is that referral centers are they're a hyper select group. First of all, you're dealing with a population that, as a general practitioner, I have passed on. Now, this runs into it all the time. So if a referral center is looking at, say, an impact of spaying and neutering on something like this, then they may be able to focus on mammary cancers or something along those lines, or lymphoma or bone cancers or something like these, because that's the ones that they see, and those are the dogs that the general practitioners cannot handle. Now, as a general practitioner, I might be able to handle a dog with mammary cancer. I could handle a dog with a pyometra, an infected uterus, but I may not be able to handle a dog with lymphoma or bone cancer or even severe behavioral problems. So referral centers are a distillation of a select group of population, and from also a realistic point of view, they're also a population of owners who can afford the care. So if, what about all the dozens and hundreds of dogs whose owners couldn't afford to try to treat their dog's cancer? And so therefore were euthanized instead of sending them off to referral centers. So again, a super select group. The other situation is what we call real life statistics. So what is real life statistics? If you have something, if you have a report that basically comes to a conclusion that action A leads to a doubling of and causes a result B, and then results in a doubling of the incidence rate or a percentage of a problem in a population. That sounds dramatic. And if you had, say, a disease incidence rate that was 5% and it doubled it to 10%, I mean, that could be absolutely huge when it comes to diseases. But what if you were dealing with a disease that had an incidence rate of 1/1000th of 1% of the population, and you dealt with an incidence rate that doubled and it went to 2/1000th of 1% of the population? Real life statistics would tell you that that doubling is significant, but it's not going to really affect that many people across the country. It's not going to affect that many animals across the country. So the other thing is when we go through a lot of this information, again, what we, as far as real life statistics, probably, again, circling back, the biggest one that we ever have to deal with on a regular basis is the breed. I'll pull out one right now. Early castration in Rottweilers seems to lead to an increased incidence rate of bone cancer, a cancer called osteosarcoma. Now, osteosarcoma is incredibly aggressive. There's not a lot you can do about it. Once we've actually diagnosed it, the options are limited, and to be perfectly blunt, it tends to be a terminal situation. The dogs only have a few weeks to live. However, does that hold true for all breeds? And I will tell you right now that the answer is no. So when people are studying these specific things, and if you're sitting there and you have a Cavalier King Charles Spaniel and you read that about the delay in castration may help with bone cancer, it doesn't affect your dog because it deals with one breed. So anyway, as we move forward, we are going to then talk more specifically about what is going on. So on that note, we're going to take a break and for our sponsors, and then when I come back, we'll pick up where we left off. Hello and welcome back to the Captain's Table. This is Dr. Jeff Pelton again, and we are in the middle of discussing the timing of spay and neutering your pets. So I know the first part of this was extremely dry and discussing about statistics and why we do the things that we do, but it also just hopefully gives you a background as to why it can be so difficult for us to figure out what exactly is going on and what recommendations that we should be making to our pets. So the second part of this program, we are going to be discussing very specifics about why the recommendations have changed. So again, as I mentioned before, the issue with cats is actually very straightforward, but I do want to visit that topic at least briefly. So one of the things to keep in mind is, as every veterinary student is taught in this country, is cats are not small dogs. A lot of the things that we discuss, a lot of things that I discuss with my clients people have a tendency of lumping all their animals into one group, but no, cats are not small dogs. When I was, over the last 30 to 40 years, the incidence rate of what we call pediatric desexing, which is spaying and neutering the cats, basically as kittens in the shelters, was a program that was started a fairly long time ago. And even when it was started, it was not without controversy, because a lot of people thought that spaying and neutering that early was going to have some problems. Overall, I will say right now that that has, again, given the benefit of time, that has proven to be false. Actually, the statistics have looped back around to show that not only do the animals do fine, they actually do very, very well. Healing rates are incredibly fast. You do not alter, you do not change a lot of these animals, do not have problems with the surgery, and there are a whole lot of consequences. When I was in school, one of the biggest reasons, not specifically spaying the female cats, but neutering the male cats at a young age, one of the metabolic or one of the emergency issues that we deal with in veterinary medicine is what's called a blocked cat. Now, this is when there's a male cat who has usually suddenly has his urethra plugged. That plug is usually a combination of crystals. It can be blood. It can be bacteria. Basically, what has happened is that there is a severe inflammation in the bladder. That creates a sort of a sludgy discharge, and as the animal urinates, that discharge can become very gritty, and it plugs up the urethra, and it is a life-threatening problem. It can be a very, very expensive problem for the owner to deal with, and requires an immediate intervention, otherwise the animal will not survive. So the idea, though, was that without the influence of testosterone, the male cats, their urethra, the size of the urethra, the diameter of the urethra was going to be small, and that under the influence of testosterone, the entire reproductive tract was just going to be bigger. It is literally the argument, it was just a size problem, that a bigger diameter was going to allow for more crud, essentially, to flow through and be eliminated and reduce the risk of getting a block. And so one of the biggest arguments for a long time was that pediatric castration in cats was going to increase the likelihood of getting a male cat blocked. And I can just tell you right now that basically that those statistics did not bear out. That all the information that is out there proved that is not the problem. What is the issue? So what causes blocked male cats, which is, again, something that most practitioners see on a pretty regular basis, and it's one of those nightmare scenarios that nobody ever wants to hear about, that someone calls up and their male cat is vocalizing in the litter box and is acting funny and straining. And that's something that breaks us out into a cold sweat all the time. Basically, that scenario, that syndrome, is more of an impact of genetics, diet, and lifestyle. And lifestyle meaning that indoor cats have a tendency of being obese, and obesity is a huge link to this. And yes, some people will argue that if you don't neuter your cat, your cat's going to be less obese going on, but in reality, that is not necessarily true. It has to do more with lifestyle and diet, and then your cat's genetics. I have had more than one situation in my career where the cats from same litters, one cat will routinely become blocked, and another cat, male cat, has no problems whatsoever. Same diet, same household, same everything, and yet one cat continuously has a problem. The other aspect of that's sort of the male aspect of it. So getting the cats neutered and spayed early is also is strongly recommended. In female cats, kind of like in dogs, which I'll be talking about soon, there is a strong incidence rate of mammary cancer if a female cat is left intact during their life. And just like in female dogs, mammary cancers can be very, very aggressive. And so as a result, any chance you have of spaying and neutering the animals before they become reproductively active is always a good idea. Now, the other thing that people have a tendency of forgetting, and this is something that I have people look at me with raised eyebrows all the time, is it falls under the not unusual category that a female cat can become pregnant at somewhere around 4.5 months of age, if given the right situation. And so, and male cats can be sexually active at that time as well. And so, even the routine recommendation of spaying and neutering by 6 months of age can sometimes be too late. And so there are some people, and our clinic is one of them, that adopt a basic slogan of fix by 5. So all cats fix by 5, and that means get them spayed or neutered by 5 months of age. And we try to adhere to that as much as possible. Some people, in a real life situation, a lot of times, at least around here in my population, actually, it's not a conversation I have to have too often, because so many of our animals come from shelters that they are already spayed and neutered by the time they come out. And I think that a lot of people will have that same situation happening for them. But at the same point, if you're in a situation where hey, I got this kitten, it was part of a surrender, or my friend found a bunch of kittens and we found homes for him, that kind of idea, to help with everything, just with a cat, fix by 5. And that's a little slogan you can always fix it, or always adhere to. So, okay. Changing gears, we're going to go into dogs, and I would like to start essentially with the easier one, which is male dogs. Okay, so male dogs is a much more, what I tell my clients is this is a much more linear situation than it is with the female dogs, and that's why I want to tackle this one first, because it does seem to be a lot of it has to be it just seems to be a little more straightforward. Okay, so one thing is as we talk about this, again, the universal blanket recommendations that go across all animals is not going to hold true. And, I cannot look at a client who has a French bulldog and think that the recommendations I make for that animal are going to be exactly the same for the person who has the 90-pound Labrador who's super, super active. So let me kind of take a step back, and there are 3 issues that we deal with mostly. Now you can talk, if you go through, do a literature search, you do all these things that some people will discuss multiple issues with regards to delayed castration. And that's basically what we call it, delayed castration in certain animals versus castration at a, quote, normal time. And that normal, quote, normal time is going to be somewhere around 6 to 7 months. So who gets castrated early and who gets castrated late? One of the things that did come out, I'll just take another step back, kind of going back to what we first talked about in the first part of the program. There was a big study that got released by UC Davis. Actually, they've released a number of studies, but a big study got released a couple years back regarding specific breeds and ages of recommendation for breeding or for spaying and neutering. When it first came out, a lot of veterinarians, we were very happy because we were going to be able to say, hey, here's some specific data. We can kind of look up, hey, this dog has Australian Shepherd, and therefore this is our recommendation. The problem that came out with it is, as we've over the last few years, the statistics on it, I don't want to say that they weren't done appropriately, but I'm not a statistician. But from what I've read, a lot of statisticians do have a big problem with the way they achieve their data. And so as a result, it went from a very hyped up study to one that is, we do take it under consideration. When it comes to some of these things, when it comes to male dogs, obviously one of the things is it's the maturation factor. A 12-pound Chihuahua is going to mature physically faster than a 120-pound Rottweiler. And as a result of that, you cannot say, hey, what holds true for what dog? And so when we try to figure out what are the groupings, what can we potentially do with these male dogs to try to figure out who gets lumped into which category? How do we make these recommendations? How do we fine-tune these recommendations? And obviously, there's too many breeds, and that's what the UC Davis study was trying to do, and there's too many of them. You cannot just simply go through it. There's not enough information out there for us to take this information on every single breed. So if we take breed off the table, the one thing that obviously makes the most sense when you look at male dogs is size. And by size, I mean adult size, adult weight. And the current recommendations that a lot of people do are what we call, there's one recommendation for a, quote, small breed dog or medium breed dog versus the, quote, large breed dog. Now, depending on where you live in the country and depending on your clientele, you may have different ideas as to who falls into those categories. But most people, I think most veterinarians right now, are going to be drawing that line somewhere around an adult size, meaning this is like where they're going to top out at 45 to 50 pounds. Anything above 50 pounds is going to be considered a large breed dog, and anything below 50 pounds is going to be considered a small breed dog. Now, you could argue this again, and all of this information, even the information I'm giving you today, you can argue this. You can find fault with what I'm saying, and I'll be the first one to tell you, you know what? This information is not perfect, and what fits for your animal may not fit for every. What fits for your Labrador may not fit for all Labradors. The other thing is what we deal with all the time is personality, and so we try to take that into effect. But let me kind of run through the three things that we deal with. Two of them are orthopedic. One of them is the thing that everybody points to, which is the cranial cruciate ligament injuries. The second thing is hip dysplasia and formation of the hips. And then the third thing is behavior. So going back, where this started was a lot of people, or some, I should say, orthopedists, started seeing, and we've been seeing, a bigger uptick of cranial cruciate ligament injuries in dogs. And when that starts happening, people started looking back and saying, this is one of those situations like, is this, we're seeing this specific problem. Is this really a problem? Has this changed over the last 40 years? And the short answer is it looked like it did. So what the theory is, or what actually not the theory, what happens is if you have a male dog who develops with testicles under the influence of testosterone, if you have two dogs, I hesitate to use the word clone, but I'm going to use that word. If you have two dogs that are two male dogs, clones of each other, and you castrate one of them at 6 months, and the second one you wait until they're, say, 14, 16, or 18 months of age, and let's just say these dogs are going to they're going to top out at 80 pounds. If you look at the difference between these two dogs, the dog that was castrated early compared to his late castrated brother, he is going to be taller, he is going to be leaner, and he's going to be less muscular. So what happens is under the influence of testosterone, all the growth plates in the body close at a certain time. And when that testosterone is removed via castration, the growth plates stay open longer. So what does that mean? And this is every bone in the body. Well, what that means is that every bone in the body, in the dog's body, is going to be a slight bit longer than if you had left him intact. So now when you look at all the different bones in the body, every single bone that the dog has in their skeleton, does it really matter if one of their toe bones is a couple micrometers longer? No. Where this comes into play is in what we call the long bones of the body. and that's going to be the humerus, which attaches the shoulder to the elbow, and the femur, which comes off the hip and goes down to the stifle. Now, as a result of that, a dog who is castrated early in life, those bones are going to be significantly longer. All right. So a dog who is castrated late in life, there's going to be two effects. One, compared to his brother, the bone is going to be shorter, it's going to be thicker, and there's going to be more muscle surrounded. That's just what happens with testosterone. So why does that matter? Well, when you look at it from a physical point of view, physics tells us that the longer the rod, okay, if you have a rod, the longer the rod, when you apply torque to that rod, there is more force on the end, the longer the rod. If you have a short rod, you cannot produce that much torque compared to if you have a longer rod. So if you have a dog with a certain length of a bone and you increase the length of that bone, you're going to produce more torque on the end. So what does that mean in real life? Okay, so the humerus, the bone that attaches the shoulder to the elbow, it doesn't really matter. The dog's front legs have a tremendous range of motion. And so between the elbow and the wrist, and then also up to the shoulder, that increased torque, that increased force on either end of that bone can be mitigated through the joints. However, when you go to the back legs, the pelvis, the way the femur sits inside the pelvis, you don't have as much freedom of movement. The femur is locked. And it is supported by a very, very strong structure of the pelvis, the bone, all the muscles, all that joint capsule, all that stuff. And so that is a very, very, very stable structure. So what does that mean? That if you have a dog with a longer femur and you have an increased torque, that increased torque is going to be transferred all the way down to the stifle. And the stifle is the knee. For those of you, it's like the human knee. And just so you know, quick anatomy lesson, the human knee is actually very similar to the canine knee. And when we talk about an athlete blowing out his knee, it's almost the exact same injury as what a dog does. So what ends up happening is dogs who are castrated early have longer femurs. Those longer femurs predispose. I'm not saying it, this is one of those things that predisposes. It doesn't cause, it predisposes the dog to a potential injury to that stifle. The most common orthopedic injury, cranial cruciate ligament injury. So as a result, coming full circle, by castrating early, you increase the chance of having cranial cruciate problems. That's kind of what it boils down to. And by castrating late, you get a shorter, thicker, more stable leg, and that causes less injury. That's it. That's the reason behind it. So the other thing is there has been, when you look it up, there has been an association with hip dysplasia that certain dogs, if castrated early, have increased incidence of hip dysplasia. The problem with that is that hip dysplasia has been studied even longer than cranial cruciate ligaments. I mean, a lot of people who have done breeding know about all this, the x-rays you've had to take to satisfy OFA requirements. And the thing about it is, this is hip dysplasia has been studied so extensively. And the thing is this is such, there's so many different factors. There's a genetic factor to it. There's a nutrition factor to it. There's a size factor to it. There's a sex factor to it. And there's so many different issues that people who point to late castration as a potential reduction in hip dysplasia, this is my own personal opinion. I don't buy it. There's too many other factors that can go on, and I would say, just in my opinion, genetics, i.e., breed, and also diet play a huge role. Okay. So, one thing I also want to kind of go back to. So, going back around to the testosterone and the cranial cruciate. As you can understand, this is where size matters. As a result of that, again, a 20-pound dog is simply not going to have the difference between a non-castrated 20-pound dog or a dog who's castrated at 6 months versus a dog who's castrated at 18 months. The difference is too minute. It's too small. It's not going to make a difference. The larger the dog, the more significant the thing. And this is just kind of what it comes down to. And to be perfectly honest, when we look at orthopedic injuries, as a general rule, these tend to be, if you go into a veterinary surgical referral facility, these tend to be medium to large sized, very active dogs. They don't see a lot of toy poodles for cranial cruciate ligament surgeries. There are orthopedic problems that small dogs can have, but a lot of them are not built around, are not that. So, last thing, behavior. There is a reason we call it testosterone poisoning. So, one of the arguments against late castration, especially with males, is that you get the influence of testosterone on their behavior. What I tell people all the time, all behavior can become learned over time. If a dog starts showing aggression, hypersexuality insofar as the humping behavior, marking behavior, territoriality, those are things that you don't want. And if left intact for an extended period of time, that can be a problem. Obviously, you don't want an aggressive dog. You don't want a super defensive dog. So when I talk to my clients about this, that is the downside to it. Is, like I said, I tell people all the time, there's a reason we call it testosterone poisoning. Testosterone makes boys do stupid things. And so I tell people that when I endorse late castration in dogs, if the dog starts showing behavior problems at any time, whether it's 6 months, 8 months, 13 months, you castrate them immediately. Because you don't want, kind of like it's going to be better to try to manage around an orthopedic problem in the life of the dog rather than have a dog who's just going to be a behavior nightmare. So there's that. Okay, switching gears. Let's talk about female dogs. So one of the things is with the male dogs, like I said, it's more linear. The 1 year of age, 14 months of age, 18 months of age, those kind of hold true over all the large breed dogs. One of the things that female dogs have, though, is that they have a tremendous variability in their ages and sexual maturity. And so one of the things that we've broken this down into is it an age factor or is it what we call a heat factor? And so because all dogs are not identical, they're not all going to come into heat for the first time. And it has been shown, some of the studies have shown, that there's a difference in whether or not the dog is allowed to go through heats. And so that's, again, one of the most common questions. Do I spay my dog before or after the first heat? So the thing is the female dogs are not nearly as linear as the male dogs. So one of the biggest issues health-wise that we deal with are mammary tumors. Mammary tumors form under the influence of estrogen. And one of the problems with mammary tumors, just dogs and cats, is that they can be very, very, very aggressive. And if you have an intact female dog that we find a mass on, there's a very good chance that in reality, there's a very good chance that that's ended up going to be a cancer, and there's a very good chance that that cancer is going to be metastatic. It is going to throw out metastasis. It's going to spread through the body. The idea behind it is that by reducing or removing estrogen entirely, you are going to decrease the risk of mammary cancers. And for the most part, yes, the statistics bear that out. Where we run into a problem is that one heat. Statistics have shown, in my opinion, the studies have shown pretty conclusively that 2 heats or more, every heat the dog goes through increases the chance of developing mammary cancer. And there's no doubt that by removing the ovaries early, before they go into heat, before estrogen is even really felt in the body, those dogs are almost guaranteed not to have mammary cancer. But the statistics, it's a gray zone around first heat. So first heat ends up being, in our practice, the first heat ends up being the flip a coin. I tell people all the time, you can flip a coin because it's just the numbers don't really delineate very well. If you feel like you're feeling, I tell my clients, if your basic feeling is that you'd rather have the dog go through the heat based on what you've read, based on what I've told you, based on everything that's going on, I am in full support. If you want to spay the dog before their first heat, I am in full support. And the way I basically phrase it to my clients is when they ask my opinion, because this is a very common question, what would you do if it's your dog? I tell them all the time, I would spay it no matter what size it was. I would spay it before its first heat, but if on the day of the surgery the dog went into heat and I had to delay the surgery, I would not care. So that's kind of how I phrase it. That is probably the largest issue that we deal with, is the mammary tumors in the dogs. The flip side of that is incontinence. This is a very common problem. Traditionally, older spayed female dogs can sometimes become incontinent. What ends up happening is the urine, the muscles that control the sphincter, that go into the bladder, that hold urine, not don't go into the bladder, that hold urine in the bladder, are also estrogen responsive. And a very common complaint that we get is owner calls up and their dog, who's probably usually on over 10, spayed female dog, has been waking up with their bed wet with urine. And it seems to happen at night when they're asleep. What ends up happening with this is as the urinary sphincter loses tone, and then while the dog is awake, they're able to sort of maintain this. This is not a conscious thing. This is sort of just an automatic muscular thing. While they're awake and walking around, they seem to be able to control this. But when they're asleep and all the muscles in their bodies relax, that sphincter muscle, the loss of tone is enough that the sphincter opens up just a little bit and urine leaks out. The dog doesn't know it's happening. It is not intentional, and it just happens. So, again, super common problem. What do we do about it? Well, we are lucky in that right now we have a drug called phenylpropanolamine that most dogs respond to very well. What it is it's an estrogen analog, which is a way of saying that the body thinks it's estrogen. But if we gave the dogs estrogen, we're basically going to put them back into heat. I mean, that's what causes all the behavioral heat symptoms is estrogen. So we need to give the dog estrogen without giving it estrogen. So phenylpropanolamine is a drug that the body thinks is estrogen, responds like estrogen, but does not give you the behavioral components to it. By taking the phenylpropanolamine, a lot of times the sphincter tone is regained and the dog is able to then is no longer incontinent. Now, some dogs do need to stay on it. Some dogs can be on it sporadically, meaning that they give it to them for a while and then they're okay for a while, then they get leaky again, and then you kind of give it that way. Now, the people who argue for late spays will tell you the longer you leave a dog intact, the less likely you're going to have incontinence. And that is true, because the longer there's estrogen in the body, the less problem they're going to have. So I just got done saying that the longer you leave the dog intact, you have a potential problem with a nasty mammary tumor. And as a veterinarian, I would rather deal with an incontinent dog that I can fix with a pill than a dog that I have to explain to the owner the mammary tumor has already spread to its chest. That's not a conversation we like to have. So as a result of that, most veterinarians will tell you they'd rather deal with incontinence rather than mammary tumors. So therefore, spaying early is going to be better. Now, what about the comparison of male dogs to female dogs? The orthopedic issue. There is some data out there to show that the longer you let the dog mature, again, you can cut down on the orthopedic problems. The problem, that information that's a total gray zone. I think that is one of those where, yes, some of the information suggests that, but at the same point, there's no testosterone, or there's minimal testosterone in female dogs. And so it's not as linear as it is in the male dogs. So we don't know why. Now, is it an age thing? Is it a maturation thing? Is it a skeletal thing? A tendon? We don't know. We just don't know. And yes, there is some indication that, again, spaying them early, you might increase your chances of orthopedic problems. But it's a gray zone. So when you balance the three things, mammary tumors, orthopedic issues, and incontinence, in most people's opinion, they would rather recommend an early spay before their first heat or after their first heat, but definitely do not let them go through a second heat. Then in the life of the dog, than to deal with anything else. So where does that bring us? That brings us to are basic recommendations. So, already talked about cats. Fixed by 5. Boom. Cats are done. So, male dogs. For small and medium-sized male dogs, recommendation is across the board, castrate by 6 months of age. Orthopedic and some of the cancers that people have linked, not a huge factor here. What it can be a big factor, behavioral. However, if the owner wants to wait with it a little bit, I just tell them these are the risks. Large breed dogs, basically these are the dogs as we discussed before, over 50 pounds top out. Recommendation is 1 to 1.5 years of age. This will hopefully decrease the orthopedic problems as well as some of the cancer issues. However, as I mentioned before, if behavior becomes an issue, castrate them immediately. Do not let them mature and become a problem that way. For female dogs, small and medium breed dogs, strongly recommend spaying prior to their first heat, because then there's going to be no issue with mammary tumors and any kind of potential orthopedic issues. Again, kind of like the male dogs, they don't exist. So large breed dogs, our clinic official stance is before first heat. However, as I said before, if the owner wants to go through a heat, I am in full support. I totally understand it. As a side note, I will say, I've had a lot of people come back to me afterwards and say, don't ever let me do that again. Dealing with a dog in heat can be a nightmare. 1 to 2 weeks of bleeding around your house, potentially having to wear a diaper, all sorts of issues. Every dog in the neighborhood acting weird around it, male dogs becoming almost aggressive around it. I've had a lot of people come back and tell me they will never, ever, ever do that again. But no matter what, do not let it go through a second heat or more. So hopefully that has clarified some things for you guys. Hopefully I was clear in my information, and that provided you some things to think about. So once again, thank you again for listening to the Captain's Table. This is Dr. Jeff Pelton signing off.